recording, and then as soon as we get so whenever you're ready, if you want to call the meeting to order.
Thank you. And let me say good morning to everybody that I have not spoken to yet. Thank you for coming back on. And I tell you, this is as the city manager alluded to earlier, this is a working committee. Thank you all for last night and coming back this morning. But Bob, we'll go ahead then and call the roll, which I don't have that in front of me right now.
I've got it, Mayor, if you want me to just kind of run through the list.
Yes, sir. Please. Thank you.
So when I call your name, if you'll just indicate if you're present. Eldest Tanka Downey.
Yes, here. Good morning.
Good morning. Mignon Chubb Hale. She may join us by phone a little bit later. Jan Keister.
I'm here.
Thank you. Bethany Lackey. Mayor Lee, of course, is here. And Vice Mayor Cobb.
Hello.
Chanel Steelman. Antonia Segovia. I think Antonio had indicated he had a conflict today. Cynthia Lawrence, and she should be joining us a bit later, she indicated. Karen Pillis. See Karen.
Here.
There you go. Thank you. Debbie Brown.
Here.
Thank you. Abby Hamilton.
I'm here.
Brenda Hale.
Here. Good morning, everyone.
Good morning. Diane Haley. Brian Wells.
Here. Good morning.
Good morning. Ellen Stick.
Here.
Rachel Hopkins.
Here.
Landon Howard.
Good morning. Here.
Shalene Powell.
Hey, good morning. I'm here.
Thank you. Tommy Page.
Present and or accounted for.
Thank you. Kat Pascal, sorry. Nathan Webster. Troy Cook.
Here.
Thank you. And Tamia Franco, and Tamia, I think, indicated she had a conflict. Joyce Wall.
Here.
James Smith.
Here.
Jarrell Rhodes. Cheryl Mosley.
Good morning. I'm here.
Good morning. Carol Tarrant. Andrea Micklem.
Here.
Christian Bryant.
Here.
Pamela Smith.
Here.
Chris Bryant.
Here.
Thank you. Carol Rowlett.
Here.
Pete Eshelman.
Here.
Joshua Patrick. Gloria Manns. And Brianna Wilson.
Here.
And did I miss anyone? I got everyone. Okay. And Mayor, we do have a quorum again, so thank you.
Great. Thank you. All right. We just want to approve our minutes from our last meeting. I think everybody has a copy of those minutes.
Yeah, I should have. You should have received that this morning. Both minutes from your meeting on the 8th, as well as the minutes from the public hearing last night. So two separate motions, but hopefully you received both of those.
So moved on the first.
Second.
All right. All right. All those in favor, let it be known by saying of aye.
Aye.
Opposed, none. All right. The minutes from the public hearing last night. The motion to approve that.
I move to approve the 14th of July minutes from the public hearing.
I second it, Chris Bryant.
Thank you. All right. Any questions, comments? All those in favor, let me know by saying of aye.
Aye.
Opposed, nay. All right. Thank you. Minutes, both minutes have been approved. Let's, well, Bob, I'll turn this over to you as we go forward this morning in our final meeting.
Okay, thank you. As far as reports to officers, there obviously are none. In terms of unfinished business, let me give you just a little bit of follow-up from the public hearing. I had indicated that we would try to reach out to folks that were unable to join us. And not surprisingly, those that had made contact, it was because of their interest in the school board meeting, which was going on at the same time. And so a couple of those folks did provide responses with what it was, or they followed up with those things. So let me just highlight a couple of those. Laura Mason, who actually I think spoke at the meeting as well, did a follow-up as well. Again, she was wanting just to reinforce her support for small businesses associated with it. Lark Dunton, who had signed up but was unable to join the meeting, focused on childcare for particularly low-income individuals, as well as funding for the Bradley Free Clinic. And she also made mention of a program which was that she had experienced in Alabama that dealt with linking unemployed individuals into kind of technical training. And she gave a couple of examples associated with that. Becky Sisson, who was unable to join, actually emailed and indicated that while she appreciated the opportunity, she actually had no further comments on it. And then Fern Henley, who did participate last night, sent a follow-up as well. She had previously spoken about forestry. She also talked about some information relative to law enforcement. And those were all the folks that we heard from following the meeting as well. And also, and we'll get into some of this a little bit further, but wanted to acknowledge that the vice mayor had a conversation with Brianna and with Christian, and they've provided some additional information that we'll get to in just a few moments and stuff. So that was what I had in terms of unfinished business. And any other questions or anything associated with that? Nothing with that. Then we will move to the new business, which will be the bulk of our discussion today. The good news is this is the last official meeting of the task force. And again, I really appreciate the dedication and the commitment that you all have had to do this every single week. I told some at the beginning of this is definitely the most dedicated group of task force members we've had in a long time. So be warned, because the mayor said we need to keep names, because then we know who to appoint to future boards and commissions. So definitely appreciate the commitment and the engagement. You've not only been here, you've engaged all through this. That's the good news. The challenging news is we're about to make sausage. So I apologize for the headaches that everybody's going to have by the time this is done, because now we got to kind of figure out how to pull all of this together, and we'll do the best that we can. And really, you all have set a really solid groundwork as we go forward on this, but I know there's still going to be, this meeting will not flow perhaps as eloquently as our previous meetings have been. It'll be a little bit bumpy as we go along and stuff, but all good as we go forward. So what I would like to do is let me recap a little bit of what the work is that you've already done, where we are, and what I would hope that we can achieve by the time this meeting ends today. So obviously we've gone through these meetings, getting a little bit of background as to kind of what the situation is in our community and what the purpose of this recovery fund is, along with some of the limitations tied to the funds that exist. From that, of course, you all started brainstorming about ideas, possible initiatives, possible projects, those kinds of things. Came up with probably 50, 60 of those. We then went through a process where we tried to get that down to kind of some prioritized list. That got us down to maybe 20 or so of those kinds of initiatives. And then the last thing that you worked on is I took those with the help from a couple of you. A couple of you had actually kind of sent to me some ideas about how to group these, and I just kind of ran with that. And so took some of what was in that big list and grouped them into the broad categories that we've talked about previously, or that I think encompass what's in it. So we talked about a collection of initiatives that fall under community health, a collection that fall under economy, some that fall under safety net, and some that fall under youth and education. So those are kind of the 4 categories that we use. And there was some overlap intentionally between the categories, and that's okay at this point. But it was those 4 categories that we said pretty much all of these initiatives fall somewhere in one of those 4. And then your task was 2 things. One was to prioritize by percentages each of those 4 categories, and to at least begin thinking about how each of those initiatives could respond to the equity tool that we had put out with those equity questions. So those were kind of your two sort of homework assignments. And most of you have provided me with your percentages as we have gone through, and I appreciate it. And you all, mayor and vice mayor don't count in what I'm about to say because they already fall into this category. You all would make a great group of elected officials, because after I've averaged everything out that I've received, it falls out almost 25% to each of the 4 categories. So it's not quite like that, but getting close. So where we are right now in the percentages is on the community safety, the community health, it's at 23%, economy at 30%, safety net at 26%, and youth and education at 21%. So again, roughly about 1/4 of what is available. And you all know that it's going to be a lot more nuanced than that, because some of the money can be used for some of these purposes in different ways. And so we'll have to kind of massage that a little bit, but it's giving you at least a sense that, kind of where everybody seems to be shaking out. I will also say that a number of you, and I'm thankful that you did this, and wish I would have asked this question when we sent the homework out as well, that a number of you, when you responded and said, by your percentages, you also went into those particular initiatives and said, I'd assign, I'm making this up, but I'd assign 30% to economy, and inside economy, this one, or maybe these 2 are really critical. And so I think that is a piece of what we'll talk about today as well. So that's where we are currently. Where I hope we can be by the end of this is that we can arrive at a consensus among the group about kind of the percentage, for lack of a better term, breakdown across those 4 categories, that we feel comfortable that, yes, that does really represent as a group what we think ought to be, and to dig a little bit deeper into each of those initiatives to do what some of you have already started, which is, okay, if 30% of the money is to go, or 30% of the effort is to go toward economy, are there any particulars in there that we really ought to focus on? Because what that would do is, let's just say we could identify $1 million, for example, to go into the economy part of it. And if there was one thing that everyone says, that's the one that's really, really important, then probably what we would do is say, okay, was that important enough to put half of that money into that one and then divide the rest up among the other? Or is that one, not quite that important? So we'll talk a little bit more about that piece. So that would be the kind of the product that we would. My goal is, although I'm not ready to make this firm commitment yet, but my goal will be that there's 2 ways that this information can get presented to the council on the 20th. One is, it's basically a list similar to what we've already done, 1-page list that basically says, here are the priorities, the kinds of initiatives that we propose, and that's it. And that's what we hand off to them. And we'll have that by the end of this meeting. My goal is, I'd like actually to wrap that recommendation around some of the things we've talked about, some of the background information that led us to this, a little bit about the process, and a little bit more information about those. I really would like to do that in a way that gives you all at least one shot to kind of look at what I've crafted to make sure it reflects what is the feeling of the group. Obviously, between now and Monday, there's not a lot of time to make that happen. So that is my goal. I'm not ready yet quite to commit to that. Know that as a default, we at least will leave here with the list that we can provide, and hopefully I can craft the document that will wrap around that as well as we go forward. There's a couple of really good examples out there of what some communities have done to help kind of illustrate that as we go forward. So are there any questions about kind of where we are at this moment, and then we'll kind of launch into the work for today. And Tommy, I'm not going to call you out on the chat. Tommy said he's terrible at homework, but he did show up for class. So we'll give him we'll give them points for that. So, so I did call you out, even though I said I wasn't going to. So. But it's okay because I think everybody can read the chat anyway. So, you were stuck. So any questions about where we are currently? All right, great. Oh,
Bob, I have a question.
Yes.
What are our thoughts about the input from last night's meeting? I think a lot of it was incredibly consistent with what we've already discussed, and what it pulled out were specific target populations that may have not been discussed within the context of our meetings. Do you anticipate that we would kind of cover that when we break into the small groups?
Yeah, that's a perfect segue into what we're going to do next. And so, yes, because I think the next piece of this now is let's talk for a few minutes about both what we heard yesterday at the public hearing, and also two other things. Anything new that we've received as a part of this that didn't even come out of yesterday's meeting. And or anything else that you all have thought about. So let me start with the yesterday's meeting. I would concur with what Abby just said, which is, either what we heard last night was either items that you've already heard previously. I'll use Mike McAvoy's item as an example, that you all already have on your list, the idea of some kind of utility payment assistance for those that have become delinquent. So I think it was good to hear from Mike to reinforce that need, and he provided some data behind that need. He identified some number of individuals, and that there's about $90,000 of bills out there currently delinquent. So that was good to hear. You also heard from a group of ideas that probably just aren't eligible for this kind of program. There was discussion of like tree planting and those kinds of things. And while those may be important things and needs in the community, they're not really falling within the bounds of kind of what we're talking about here. The third thing that I heard out of that meeting was Janine raised it, and there actually were a couple of other comments that had come in other avenues, in other conversations that we've had, that our health clinics in the community that offer free and low cost services to the community, and again, there's 3 or 4 of those that are doing this, all are feeling the strain right now. I spoke with Janine this morning, and they're registering about 25 new patients per day, folks that have never been in the clinic before. So their resources are getting stretched, is how I would say that. So I would put that in the category of not necessarily a new item, because we had it on the original list, kind of additional funding for health clinics, but just an item that the group may want to consider to say, is there any interest in that getting moved back off that big list and put into a prioritized list? So that's one piece of the conversation, and then I'd like to talk about that, and then I'd like to move to perhaps Brianna and Christian and talk from a youth perspective, because they've only been able to kind of join us here at the end, and Joe had a really good conversation with them, and I'd like to kind of hear from them sort of what their perspective is from that side. So we'll come to Christian and Brianna in just a moment. I first want to see if anyone wants to pick up on that issue regarding the health clinics. Any thoughts regarding the health clinics and the desire or the need to pull that item, that funding of those forward into the priority list, or are we still content? Remember, we've got pieces of that already in this, PPE, testing, those kinds of things. This would be, if we brought it in forward, it would really be effectively kind of grant funding to help them recover, kind of to be able to actually deal with the increased workload. I'm going to stop there and see if anyone has any thoughts.
Bob.
Oh, go ahead.
Yes. I don't know who that was. Was that Karen?
I was somebody else as well. I know that one of the other concerns about the health clinic is kind of broadening the mental health focus to a mental health substance use focus. And I assured the meeting that I was on today that we had had those conversations, that it had been included in all of our conversations. But I think the concern is that we haven't lifted it up and named it as part of those services. So I think we need to be cognizant of you know, that overdoses have increased, and there is people who have been in recovery have fallen off the wagon. And so I do think that we need to keep that in mind as we're having this discussion, that when we talk about health clinics, are we talking about just physical health? Are we talking, if we're wrapping mental health into it, we also need to consider naming it substance use as well.
Yeah, and of course, you know, you all have right now on your on that priority list, we still have retained mental health. And yes, I think because there had been discussion previously, if there's consensus among the group, I think there's a recognition that should be viewed in its broadest sense, that it is perhaps what we conjure up in our minds as mental health, but also to include substance use, obviously suicide prevention, those kinds of things.
Right.
Because again, I think that's been a part of your discussion throughout this, and we just need to be certain that when we make those recommendations that we have that. And hopefully by the end of this, that'll make sense why that nuance is important as we talk about some of the ways in which we think, some of the ways that I've thought about how we could implement some of these initiatives. So if everyone's comfortable with that, I think we would certainly say, yes, it would need to be as defined as broadly as practical. Somebody else was starting to speak up also on
Bob, that was me, Tommy Page. I did want to jump in real quick, kind of on that. It's been, you know, I've enjoyed the task force, but it's kind of left me at a place of not knowing exactly how to approach some things that we've already been working on. So I spoke with you before, of course, with Vice Mayor, of what we're doing in Gainesboro. And when Janine brought up the healthcare element yesterday, really, because we've been working together to try to find a solution in Gainesboro, as well as being able to bring the Clater Clinic back to some form of operation. So we've been working on that for the past 2 years, and it's kind of wanting to find a way to see how that could be incorporated, as well as helping the minority, the situation we're trying to do. But it's just been a challenge because as a task force member, I didn't want to be kind of conflict to present these things, but I definitely wanted to send something your way to look at, because I think it could be a highest and best use to get involved with some of the things we've already proposed, and at this time making that work. So I just wanted to know exactly how do we go about those members of the task force who are already on projects. How do we go without not saying, hey, but I need some help over here for myself, but we want to actually be put into a priority for what all we're actually doing with this task force.
Yeah, no, and I think, you know, part of the reason that most of you are on the task force is because of the perspective you bring in what you're currently doing in the community. And I think it's appropriate that folks bring forward the types of things that they're working on and where there may be benefits in funding those if it's possible and that type of thing. So, you know, I don't think it's inappropriate for that. I think everyone's done a really good job of presenting that perspective, but not making it just about, you know, their particular project, their particular effort or initiative. You know, and again, I think the health clinic one is a good example that, you know, this is not necessarily about the funding of any one particular health clinic or one particular program at this point. It's really trying to figure out, you know, is there an interest in not only the piece associated with like the provision of PPE and additional funds for COVID testing through the health clinics, is there an interest in actually providing dedicated funding that's just going to help support the health clinics? That's an example of that. But yeah, I think it's, you know, again, most of you are on here because of some perspective that you bring, and certainly should be able to bring those ideas forward. And Tommy typed in, you know, it's one of those pieces that really adds to kind of resiliency, that piece that's long, that kind of transcends the immediate. That it's, you know, and that was the idea I think that you were all trying to balance with, like the safety net piece in a lot of ways is to plug the hole, but then some of the other things you've talked about are really how do you keep the community kind of advancing beyond the immediate. Yeah, definitely. And again, I'll come back and talk a little bit about how some of that might get operationalized after we settle on the set of recommendations and what that might look like for implementation. Okay, well, so before I leave.
Oh, I'm sorry. I would just like to make an additional comment about funding the health clinics, because talking with the rescue mission and with the Bradley Free Clinic and those clinics and the nonprofits like the West End and the PCC Center, they are they're struggling because they're all seeing numerous extra clients. So just funds for them to buy food and the cleaning supplies and to keep their different agencies going because of the increased amount of clientele that they're getting in. So I agree that that needs to be in the in the consideration.
Okay, well, if everyone is comfortable, what I would propose, and see if you all are comfortable with this, is, you had on your master list of initiatives and ideas, you had one which was funds to address increased costs to health clinics. And again, this is somewhat part and parcel with PPE, but kind of transcends it. It's a little bit more than that. And what I would propose, based on what you heard at the public hearing, as well as some of the other conversations that have gone on around it, I would propose moving that particular initiative forward into the preliminary prioritized list under community health. And if there's a consensus with that, I mean, if everyone's comfortable with that, at least at this point, then we'll do that. Is everyone generally okay with that piece? I'm seeing yeses and nods and stuff. So okay.
Yes.
Okay, well, we'll do that for right now, and then we'll come revisit that again as we move forward and stuff. So,
Can I ask another question?
yes.
Based on the announcement from the school board yesterday about plans for reopening, how does that impact, or maybe it doesn't, the priorities that we need to be focused on under youth and education? Are there any adjustments that we need to be making?
I don't know if there's any adjustments yet. I spoke with the superintendent yesterday prior to the school board meeting so that we could talk about what they were proposing. And I talked with her a little bit about what you all have talked about previously, which is that, obviously we have a priority that focuses on youth and on education, and that there is the likelihood that there will be some funding available to address some of what may come of that. And they're not quite, and I think Jarrell had brought this up in a previous discussion, they have not yet reached the point where they are ready to craft kind of that list to be able to say, these are the things that we need to meet the ability to actually operate the way we're proposing and where a gap might exist. So at this point, I kind of feel like what you all have put together as priorities still makes sense, while at the same time acknowledging that I think as she gets further into that conversation with the board, that may have to get tweaked a little bit as we get further into it. And I know that she had fairly lengthy conversations with at least the administration components of the schools yesterday prior to the public meeting as well. So I don't know if there's anybody else on the Zoom call that knows anything further about that or any other thoughts. Pete, you got your hand up.
Yeah, I know they get CARES money too. They have the same restrictions on the funds that they get as ours.
Yeah, they do. And so they're using, one of their big concerns was that they were going to have to use a significant amount of that to offset transportation costs. And with this model that they're using in with the 3-foot kind of separation instead of the 6-foot, those costs have decreased some, but she did still seem to think there were probably still going to be some gaps associated with probably some PPE and also probably with some technology, both of which you all already have in your list of priorities. So that was sort of her first thought as to where there could be gaps. But yes, they're still under that. And I don't know how that works for the next semester for them in light of the limits on the CARES funding, unless they change something.
And Bob, what are you calling that line item that you're adding in, and what category are you putting it under?
For the health clinic one?
Yeah.
So for the health clinic, it was, the line item is funds to address increased costs to health clinics, and it's going into the group of community health. So it'll be a new one under the community health. And then the schools, just by way of a reminder, what you've got right now in youth and education, you've got COVID safe parks and recreation programming, funding to promote links between organizations and schools in educational offerings, access to broadband, it says intent, sorry, broadband and internet and devices to connect for distance learning, job searches, and so on. And then youth advocacy, which was focused around trauma, interpretive services, community collaboration, and so on. And I feel like based on what we know right now, those still fit within kind of the need. And actually, this is really a good point to perhaps to pivot to Christian and Brianna, because I know they've thought about some of these things and had talked about it. So Christian, Brianna, you all want to kind of join in and talk a little bit about what your experience and what your concerns are from that perspective as you all get ready to embark back into the school year?
Sure. Yesterday we had the opportunity to discuss some things with Vice Mayor Cobb. Some of the things you've already said, whether it's under community health, youth and education, our concerns within the economy and communication amongst everyone, and letting everyone have a voice into some of the things that they are experiencing now. Since being placed at home, back early in March, we were told, hey, we're going to have you guys out of school for 2 weeks. It was, okay, are we going to go back? Is everything going to go back to normal? How long is this break going to take? Not even within the first week of that, we were told, okay, this is much more serious than we thought. This is going to end up closing out in school learning for the rest of the year. That, of course, sent me and many of my friends and classmates and everyone that I know and have grown up with into a panic, unsure of how everything was going to go on, because not only for the youth, but for everyone under and above us, this is something that we've never had to experience before, and it's very new for everyone. Some of the concerns that I've had, especially with school nearing within the next month or so, was the opportunity of a hybrid plan, whether that being in-school learning or an option for kids to continue the at-home remote learning. I myself, and before this statement was put out yesterday that there will be an opportunity for both, I was already firm that if there wasn't an in-home option, that I'd be staying home, just for the safety of everyone that I'm surrounded by and anybody that I might have to come into contact with outside of my home, understanding that this virus is something that everyone's unsure of. We have no way to know where it's coming from, how to stop it, how to prevent from spreading it. We have asymptomatic carriers. We have carriers who show symptoms. It's just something that's so unsure and scary that I'm trying to do everything that I can here to make sure that my family is safe and healthy, and I am as well. Some of the things we talked about yesterday were increased mandatory COVID-19 testing for school. I thought that when we first opened back up, when the quarantine or so, I guess, was lifted, that those who needed to go back into work, those who needed to go back into the world, it should have been a mandatory testing, just so that we could keep the case numbers down. Of course, putting PPE supplies within the schools, cleaning and sanitizing supplies, making sure that that is on stock and ready for whatever use may be. Mental health services, increased availability for students and the families. I know that this isn't just a physical problem, with this being something that we've never had to go through before. There are many people's mental states that have and can be affected within this time. So having those services there to help is something that would be very beneficial. You already discussed the increased broadband internet access. I know there are many students who didn't have the access to get online, to get the information that other students were, and with the result of that, they either weren't able to complete out the semester or they had trouble finishing on time. With many adults having to stay home and everything, going back out into work, that took away some childcare opportunities for some students, for the younger ones that aren't necessarily in school at the moment. So just working on whatever we can to make sure that they are healthy and affordable childcare opportunities for the families that have to necessarily get back into the world, and there just aren't any places to send those kids, especially with a lot of after-school centers or daycares being shut down, with them not being able to meet the quota of staying open within the past few months. Something that I really wanted to get out to the community was a survey of how living within amongst the pandemic has affected them, especially for employees and those who have to get out in the world. A survey for those people, how it's affected them, why they are putting themselves at risk to stay out into the world, whether or not they are just out working and going to school just because, or if it's a dire need, just so that we can have a better understanding of the problems that the people are facing, more so within the home rather than just as a community at once. I do believe that understanding the bigger problems that the community faces as a whole, it's important. It's a big issue as well. But understanding what's happening within the homes and the reasons that people are having to go out and face the risk that they do, whether they believe that this virus is something serious, which I do, or they're just brushing it off, as many people as we know are doing. So I think a survey of some sort, big or small, just to understand what people are facing within the homes is something that can be very beneficial. And communication of recovery efforts, all ages in both traditional and non-traditional formats, just being able to reach everyone and have everyone get a voice that they're not sure that they might have, or just letting everyone know that, hey, this is what we're doing. We are listening to the problems that you guys have. We want to hear what you guys may need and what you have gone through within the past few months. So that is just about a basic summary of the things that we discussed yesterday. I'm thankful for the opportunity to put my voice out there. I'm thankful for everybody that has helped set up this task force and the work that all of you guys have put in within the task force. I really hope to see something good come out of this. I know that something good will come out of this. I'm thankful for the minds and the well time that's been put into this. And yeah.
Thank you, Christian. And I had a question for you as well. So when you all left school and had to kind of try to finish out the semester, were all of the students provided the the computer as well? How did you handle the internet connection? I know some students got Chromebooks. I don't know if all did. Mm-hmm. And was there some kind of assistance to make sure that everybody had a connection into some kind of internet service?
Yes. I know that if there wasn't internet access at the home, there were certain packets that kids could reach by going to the school, calling in, saying, hey, I'm coming in for this class to get this packet so I can take it home and do the work manually rather than online and then take it back to the school. But the only way you could know about that is if you received a robocall or if you received a notification through your phone, or if you were able to check the website. There were a few letters that went out from RCPS, but that was maybe 2 or 3 amongst the whole final semester. So I think that if more in-person letters were handed out to the community and to each and every home to let all students and parents know that this is what you can do just in case you don't have the internet access that you might need to access the online courses and the classes and the calls that you need to help progress within the semester.
Okay. And Brianna, did you want to add anything?
Yes.
Oh, there she is.
So basically my main focus was for school also, and like the protective, for personal protective equipment. And the funding for that, my thought process was that maybe each student get 3 face masks a day, 1 for before lunch, 1 for after lunch, and 1 just in case like the mask breaks or something, if they don't have masks already. And like money for thermometers so they can get temperature checks every day before they go into their classes and stuff like that. There was also the concern for internet access, like Christian said. And if students don't have internet access, there was a good chance that maybe they didn't get the emails or couldn't access the websites. So my concern for students who don't have internet access is that if they choose not to go to school, they might have to go to school in order to attend classes because they won't have internet for like Zoom calls or Blackboard Collaborate or anything like that. And then like childcare for like the parents who can't put their kids anywhere, like there's nowhere for them to protect their kids, they would have to stay home, and then they might result in them getting laid off, or they don't have enough money to support. And then there's also another fear that too many people would sign up for school. If that makes sense, there would be like an overcrowd and not as many students would sign up for online school, because that's the thought that I'm having right now, that more students will sign up to be in school than out of school because of the horrible experience. Well, it wasn't horrible, but nobody knew what they were doing. So yeah.
Yeah, and thank you, Brianna. And I think to follow up on something that Brianna just said, and you all may already know this, so I apologize if I'm repeating stuff, but it appears the objective is, based off of the surveys that went to faculty and that went to parents, about 70% of both of those had indicated their desire to go back to in-person classes, and about 30% had desire to continue virtual, either virtual by virtue of them teaching, they wanted to say virtual teaching, and or parents wanted to keep their kids virtual. And at that number, the schools can accommodate that crowd and do so safely. But to Brianna's point, if that number becomes instead 90% want to go back in person, the indication is the schools can't handle that. That's the physical space is not there, transportation is not there to do that. So it really is dependent on a certain number of students and a certain number of faculty actually preferring and staying virtual. So that, and my understanding is the way they're going to try to manage that is kind of a pre-registration effort, so that folks will declare that and register for that option, whichever it is, and then they'll be able to adjust accordingly. That's part of why they're looking at kind of shifting the school year starting a bit later, is to give time for that to work its way out. A couple of questions. Tommy's asked a question and Chris has asked a question about other areas that possibly students could access internet. So for example, the libraries and even like places like Girls and Boys Clubs, Youth HQ, the Renaissance Academy, and some others as alternative learning facilities. Those could be options. The challenge, I think, is the 30% or so of folks who said that they don't want the children back in schools, really, I think, that don't want them back in that congregate kind of facility. And even though it'd be less, like in a library, you're still going to have them in groups. And I don't know, that may be something that still can be explored, but yeah, I'm not sure. I do think that if it actually sticks with, say, 30% of the students that are participating virtually, that's a more manageable number. And so I think the quality of what could be offered to those students, I presume, would go up. It'd be easier to ensure that they have access to internet. It would be easier to ensure that there's better communication. And I think that's part of what the superintendent is thinking associated with that. But yeah, I think some of those options will be things that the schools will be exploring, and we'll certainly work with them on what we can to try, either through this system or others, to try to help them meet that as it goes through. Any other thoughts or questions? Oh, and I wanted to mention also, and I think Debbie was the one that provided this to me. I can't recall. Someone provided kind of you all have talked about sort of a youth advocate and someone that's actually employed working within the schools that's kind of a liaison between the students and families and the schools to try to do what Christian was talking about, which is making sure that everybody's aware of what's going on and all the communication, not just rely on sort of the robocalls and the letters, but actually having some actual people that are trying to do that as well.
Yeah, Bob, may I say something? This is Andrea Micklem.
Yeah.
That was me. I submitted something about our taking into consideration. So as a classroom teacher, I did recognize that there was a gap between getting information from the schools to the community. And so first of all, I want to say to Christian and Brianna, thank you so much for giving your perspective to us. It's super important. And I sort of want to apologize that, we weren't more on the ball in terms of being able to present you some quality education and something that wasn't so confusing, but we're learning from that, right? So in an effort to keep things sustainable and with a mind for equity, I just want to say again, from a teacher's perspective, for somebody who was working with families in the spring and recognized that I didn't have the answers for parents. I was sort of the point person for parents when they were trying to solve some of their or had needed questions answered. And so I really think it's important to consider that we actually employ somebody who can help be that liaison between the community and the schools.
And I'm wondering, and some of you might know this, I know that during the normal school year, non-COVID, we have groups like the group that Xavier works with Humble Hustle, and I know Jordan Bell works with. There are groups out there. I know, Rachel, you've mentioned you have folks that are often in the schools kind of helping in that, and I'm wondering if, because I presume most of those groups are going to have difficulty actually gaining access to the schools during this time. And I'm wondering if those groups, since they exist, couldn't in effect be employed, contracted to serve somewhat in this capacity of kind of being almost, almost mentor counselor. I mean, the stuff they do anyway, but also serving as a liaison with between, again, the students and the schools. And I don't know if I haven't had a chance to talk with Xavier. I don't know if there's been any discussion about what role, if any, they'll still be able to play in the upcoming school year. You've expressed that concern about just the kind of programming you all would do with the Science Center normally, and not having access to the schools during that time.
So from what I understand, the VDOE is not allowing informal educators or contract educators to walk into our schools. And our educators are in Roanoke City, County, Botetourt, and City of Salem schools every single day teaching. So we're shifting our operation. Side note, one very impactful program that's taken off in the last couple of years, it's been around for a while, is 21st Century Community Learning Center, and that's a grant that's received by our CCS. And I will say, so that's an enrichment program. It happens after school. It runs till roughly 5 o'clock. But they have one person assigned to be that communicator between parents, schools, and I will say that I think it's a wonderful idea, but it will take a team, a large team of people to facilitate those conversations and make, and provide. It's huge. It's a huge undertaking, and that's in normal circumstances. Yeah, and so I saw the one, Tommy had mentioned Boys and Girls Club, and the Science Museum is forward learning lab, so that we have a space. We're not even going to be open to the public. Our entire museum is going to be an alternative learning facility working with parents. But I actually have a question for Brianna and Christian, and thank you. I'm really impressed by all of the information that you guys have provided, so much value in it. I'm really appreciative that you're here spending your time with us today. But last night, the school course announced kind of the 4 in-person virtual Fridays plan, and I just wanted to know kind of your feelings were about that after hearing it.
I heard through a friend. I was sent a screenshot of the Facebook post that was sent out by Roanoke City Schools within the plan, saying the certain times that each different grade levels would be in attendance, whether that be getting picked up from the bus, and how temperatures were mandatory to be taken before you get on the bus. Temperatures were mandatorily taken before you could enter the school. I think for those who want to take the risk to go back into the school, those who've had such a bad cabin fever within the past few months, and they're ready just to get back to some normalcy, I think the 4 days in and the 1 virtual day is a good idea for those, but I'm thankful for having the opportunity to stay home and continue the remote learning. Like I said before, we're just so unsure of everything going on. So having that opportunity and the option to continue the remote learning, it's very beneficial. So I'm thankful for that. But I know everyone who helped put out that plan, it took a lot of thinking on their part to figure out how it could do it and do it the safest way possible. And even though it is still a big risk, I'm thankful that there are the different opportunities and options for the students and families that decide to do either or.
Thank you.
Hey,
May I
Bob.
jump in, City Manager?
Yeah, go ahead, Brenda.
Okay, there's a couple of things. The first would be the rising statistics that the ages are being exposed to the coronavirus, COVID-19, are getting younger and younger. So the children are not a safe segment, in other words. There is potential exposure for them being in contact with one another. And no matter how you try to distance children apart, I don't think that's gonna be realistic in a classroom, playground, or any other setting. The other thing that I'm concerned about, and I spoke about this a long time ago when we first started, is where is the money coming from to fund the children that live in an environment that do not have technology? They don't have the benefit of Wi-Fi. They don't have the luxury of a laptop. We're talking about a segment of children in the community that they're doing without because they don't have this. Is it the school responsibility to provide that under their budget? Or is there some way with this task force that we may be able to supplement that? Because we don't want anyone, none of our children, falling through the crack in what they should be having.
Brenda, in the Roanoke Times article today, I wasn't at the meeting last night of the school board, but they indicated that at the meeting, the schools said that they have enough resources to send a computer home for every child and that they are working on the details with Cox to provide internet access, which says to me that the school is planning to pay for this, possibly out of the care funds that they received.
Okay, thank you. That's good news.
Yeah, and to Jan's point, that was a part of the conversation I had with the superintendent yesterday, was to make sure that she understood, based on what you all have already shared about connectivity, that if, as those conversations evolve, that may be an area where we actually have some funds to supplement what they're doing. And she did indicate to me, just as Jan had said, that they've been in conversations with the Cox, with the Broadband Authority, and also with our own DOT department here as well, to try to figure out the best way to get that. Because I agree. I think that, you know, if we put on the equity lens kind of that we've talked about in this, and if we looked at the, you know, the recommendations that you all have right now, say for the access to broadband, youth advocacy, I think you could easily say, if you put that within the put that through that lens, you're saying, well, those dollars, but those dollars with an emphasis on that more vulnerable part of the population that isn't otherwise going to have access to Christian's point. It's not, if the program is being designed so that kids can take part in this best virtually, but they don't have access to anything other than paper, then they're not getting the full benefit of what's being taught. So putting it through that lens, we would say, if we have to come in and supplement what the school's doing to ensure for that segment of our community, then that's what those dollars would go toward. So I think that's how we would use this piece of it.
I agree, Bob. And I think the new leadership, they've done a lot in 15 days, and they will take care of the logistics for the school system, how they will return. They can handle the devices that kids have, and they can assign computers. They've already done. I mean, they're used to doing that. They have the software. They're coming up with the Canvas software, but the connecting to the access to internet is my big concern. We can help in that way, access to broadband, because a lot of kids do not have, and the computer won't do any good if they don't have access to internet.
Yeah, and I think, Cynthia and Abby have added in here as well that, you've got, we have students that are homeless. We have students that just, even at the community college, don't have access to those same technologies. And so we also need to kind of figure out that piece. And I think a lot of those would overlap one another if we can figure out a way to do that. So to me, I think the recommendation, the priority you all have in this, what we would do is kind of put that nuance on it that, yes, this advocacy role, whatever, and several of you had some great ideas about different ways to use. And it feels like rather than an advocate, maybe a better way to do it, I think Rachel said it's really an advocacy, which mean really kind of teams of people and organizations saying, somehow they're going to take ownership for this kind of wraparound, if you will, of these most vulnerable students to ensure whether they're going in person or particularly if they're still participating virtually, that they're going to have the full access and the full support that anybody in person would have. And I think that would be kind of a nuance on that particular recommendation to kind of respond to what you all are kind of raising as those issues. And again, broadening that to say, while most of that will be focused initially on kind of the Roanoke City Public Schools, don't forget the students at Virginia Western, because you've got that component in our community as well that's trying to work that. And Brianna, I know you were getting ready, I think, to answer kind of the question that Rachel had about sort of your reaction to what you heard from the schools yesterday as to your comfort level with kind of what the plan is.
In my opinion, I think that the plan that they put out is a good starting plan. But also, like I said, there's a fear that too many students would choose to go to school instead of staying at home for online school. And in that case, I think the better option would be to have alternating groups that go to school. And like Christian said, there are people who may have the virus but are asymptomatic. So even checking temperatures, they might still slip through the cracks and then still might be able to pass on the virus, because a lot of kids do not like to follow the rules and they will probably take off their mask when an administrator is not standing next to them. And I also think that, I really think that there should be a limit on how many kids choose to go to school, like a reservation thing. And I think that if they do choose to go to school, that the students who don't have internet access should be the first ones to get those spots, if that makes sense. And transportation is also a really big problem. I just think that for right now, getting the pieces together, the idea is a good foundation, but I think we should build up off of that.
That's great. That's great information. So yes, thank you, Brianna. Thank you.
Hey, Bob, can I say something real quick, please? It's something that I want to make sure that we don't miss or leave out. I want to make sure that we include making sure that parents understand how to help their children. That's something that we had talked about, like during the first meeting or the first breakout session, being open to parents that don't understand how to get their kids on the platforms, how to help their kids along if they are at home. So just as we talk to these community resources and as we make recommendations, it's imperative that we don't forget the parents that don't know and don't understand how to help their kids with computers online, away from the actual school environment.
Yeah, absolutely. I mean, I think that's a great, and I knew that came up the first time, and I think that's a perfect part of what you all talked about, this kind of advocacy role that,
Correct.
having some resources in the community. I mean, it sounds simple, but as simple as somebody they know and trust, they can pick up and call on the phone and say, how do I do this? How do I actually connect into that? I think could be a really valuable resource that is outside of anything I would expect the school to fund. I mean, that really feels like something the community would come alongside the school and say, we're going to support these resources to be made available so that, they can assist in this effort.
That's correct. That's correct.
Very good. Very good. Let me, if it's okay, I'd like to pivot to to a couple of our other ones. We'll come back to all those at the end, hopefully to tie it all together. What I'd like to do is I'm going to jump to economy, and I really want to focus in on, again, some of you not only obviously assigned the percentage to each of these categories, but you also highlighted one or two initiatives inside that category. And I really want to tease those out, because if as a group you feel like, inside this one there's 8 or 9 initiatives, and if there are 2 or 3, and not that, I mean, all of the initiatives ideally would get some type of funding within this priority, but if there are 2 or 3 of these that really need to stand out, I'd like to have those kind of identified as a part of this effort. So if you have it in front of you, what I'm working off of is one of the documents that I sent to you, which was the preliminary prioritization list by focus area. But let me, I will as quickly as I can kind of read these off, just so you maybe have some recollection of what they are. So inside economy, you had job training for displaced workers, funds for marketing the reopening and tourism of our community, funding and support link between restaurants, performing arts, farmers, etc., funds to bring back furloughed employees, grants to help support small businesses, assistance with back office help, funds targeted to assist small businesses. Again, that's really a duplicate of the grant piece of it. Funds targeted to assist arts and culture organizations, and then funds for maintenance and enhancement of outdoor assets. So that was kind of the full spectrum of those. And as you look at those, or as I kind of read any of those off with it as well, are there any of those that really kind of jump off the page and say, that's the 1 or 2 that we really have to focus our energy on?
Bob, I'm seeing helping small businesses somehow as priorities. I think all of those are important, but I also see that a bunch of those things really are long-term initiatives that we just can't do in what's going to turn out to be a 4-month period with these grants. But I think that there is probably a way to just help small businesses within 4 months to get them going again.
Yeah, and I would say that the things that I've heard from others that have come in have really put an emphasis on small business. And James, I'm sorry, I didn't mean to interrupt.
Oh no, you're fine. But I think funds targeted to assist arts and culture organizations, I think that falls under the funding and the support link between restaurants, performing arts, and farmers. But I mean, they lost their revenue. They had absolutely no revenue. So I think it's important to help that group of people, as well as grants to help support small businesses, because they struggle.
Okay. So right now I'm here. And again,
I think too, I'm sorry. I was thinking too that in any of those caveats, if a small business makes a plea for a grant for money, I think some of the things that they should show in their need and their plan to use that money is to bring people back to work. So I was thinking that any of those requests within the business sector, that if they say, well, if I do this, I can bring my employees back to work, or if I spend this money, I can open my restaurant and bring so many people back to work, or if we can do this in the parks, we can hire so many people and offer temporary jobs until their jobs are open. So anything I think that helps people, anything in the business, to just give a business money if they're not going to use it to bring people back to work, that might be necessary too. But I think our highest priority in any of this should be anybody in any of those categories, if they can say, oh, I'm bringing people back to work, I'm opening this up, I'm not only helping myself being able to reopen, but I'm bringing employees back to work.
Yeah, that's fair.
Yeah, I think I would agree with that 100%. And the way that you articulated that is so important to properly utilizing the funds and creating a trickle-down theory So I do want to commend you on how well you said that. I think a lot can be taken from that statement and that plan. So I agree completely.
Yeah, I would add one thing Abby typed in here as well. Remember also that, and we'll broaden this definition, that we've heard a couple of times, heard it last night too, kind of making sure that we don't exclude as we work through, maybe even intentionally include those really micro business gig worker kinds of things as well, that, you know, so often they're sort of not necessarily included. And there's some particulars about what they have to be able to demonstrate under some of the other federal programs that they couldn't do if they were like the only employer. And those, by the time those rules got figured out, a lot of the money was already gone. So making sure we have that. But I'm hearing from you all that, you know, small businesses definitely is something you would want to elevate, but understanding that the elevation is really with the intent predominantly of preparing them to reopen for business or expand business and or bring folks back into work. That really is the orientation and the kind of the emphasis on that piece of it.
I want to add to that it's also important, and in fact, this is something typically you see in requests for funding, that they have a plan to keep going. I mean, we don't want them to rehire the employees and then have to lay them off again after 2 months. We want them to have a plan to keep going, hopefully for a long time.
But I think that, you know, to Chris's point, and I think Joe just typed something in it, an example of that would be, I don't know, let's say a restaurant, for example, that they would request for some funding so that they could take certain steps to make their restaurant more resilient and be able to reopen and rehire folks. That should increase the chances that they would stay in business and gainfully employing folks as they go forward versus, yeah, you don't want to just replicate kind of what the airlines have had to do, which is, you know, here's some money to keep folks employed till October, and then they're going to lay everyone off because there's no business. So you want to try to figure out how to hopefully help them make investments that will make it more likely they stay in business longer, keep those folks employed longer. And that speaks to the resiliency part of this as well. I mean, the idea is we're trying to plug holes, but also do it in a way that, you know, keeps things going a bit longer.
There's a component with minority businesses that they have completely had to, their business has been destroyed. In other words, that no matter what you say, they're not going to be able to restart that business. So therefore, you have all of these displaced workers. And I think it's a large percentage of minorities that are displaced workers and that need to be retrained to other jobs.
Yeah, I think there's, you know, one of the earlier statistics we shared with you all at the very beginning was the amount of unemployment claims and the percentage of those unemployment. I have that information by race, and it is predominantly folks that are either African-American or Hispanic that have been, and if you think about it, because our restaurants and hospitality industry have been most directly impacted, a lot of them were employed in those areas. And so if we can get, you know, the hospitality industry and the restaurant businesses back up safely running, then that increases the chances of that employment. The flip side of it is, a couple of you have brought this up previously, which is also some of those jobs may not return. And so focusing on getting them reskilled to be able to actually work in the areas like healthcare, for example, that may continue to expand or grow will still be an emphasis. And yes, I think you can put that, again, if we put that through that equity lens and you say, okay, we want to put furloughed employees back to work, it is certainly appropriate to say, well, let's look at who's unemployed through that equity lens, and then say, if it is predominantly folks that are Hispanic and or African American, then how do we gear things toward that segment of the community to try to get them back up at the same time of trying to get those businesses that they were employed in back up and running, again, in tourism and hospitality and in restaurants.
I mean, that, Bob, for me, for my part, I mean, step one is the tourism marketing, you know, is proven to work, and occupancies in hotels in the city have slowly started to rise, and weekends are a part of it. People are taking staycations, you know, drive to vacations. And as I go around downtown and other retail outlets that are open, I mean, they all just talk about how they would like to see the hotels in the city return to higher occupancies. And I think the ROI on that investment into some marketing would pay big dividends for a lot of stakeholders, hotels, lodging, arts, restaurants, and retail in downtown. And that is something that will have some immediate impact on tax revenues too. We're going to have a challenge this fall. One of the big occupancy drivers on weekends has been Virginia Tech football games, which, as we all know, are questionable whether they're going to take place, and if they do take place, in what fashion. So I think we need a plan B on tourism for this fall, especially on weekend dates. So some funding for tourism marketing affects, tourism in the broadest sense is everything, right? It's the gas pump sale. It's people stopping at a convenience store on the way through town. It's the dine down, downtown or out at the mall areas or anywhere really in town. But it all starts by building traffic, and you're not going to build traffic by not making an investment.
Let me ask you all about
Ryan and Bob. I do appreciate that comment. Yeah, we do have a reopen plan, but unfortunately it's not fully funded. And the most important thing for us is to get people back to work. And the thing that's really cool is there's huge pent up demand with all of, we tell people that the beach is only about 100 feet wide, but if you go to one of our hiking trails or go paddling on one of our rivers, you may be the only one out there. So we're seeing huge interest in our area, but the challenge we've got is just letting people know that we're open and that we will take care of their needs, and that most importantly, if we can get traffic up, then many of the populations and our people in our community can get a paycheck again, or have their hours expanded. And that's what we want. Is there's nothing better than creating or bringing back those jobs for people to go to work. And so any help in that area would be appreciated.
Let me ask you.
Let me say, I'm hearing a lot about, and I think it's important, job training for displaced workers. I think is important, but since I'll be Vice Mayor Carlton, I'll be voting on this on Monday. I want to listen to the thoughts everyone has about where we should go. But did Roanoke County put out a list? I know they pretty much talked about public utilities through the Social Service Department, but did they have a list of things that they were using this money for?
Yeah, they do, Mayor. They've got, so they have $1 million right now that have been set aside for small business assistance, similar to the monies, much less money, but the monies we've had out for a few months, where folks will make application, and it's pretty basic application. It shows that there was a loss in revenue due to COVID, there was a loss of employment due to COVID, what have you, and a bit of a business plan to kind of how they're going to use the money to recover from that. And then they've got it divided up based, I think, on the number of employees as to what you're possibly available to you as an award. In addition to that, on the kind of safety net side, they've got a utility assistance program, and they have a version of kind of a rent mortgage assistance program, similar to what the state is using TAP to kind of run through as well. Those are the ones that I know of, but they've kind of got a little bit of those kinds of programs that are running out there. They're using a fairly sizable part of their funding to actually relocate their health clinic out of their administrative building because they've got all their employees who may be testing for COVID having to come into their administrative building and their arrangement. So they're actually relocating that and they're using a chunk of the money for that. But they definitely have those assistance programs as well. I wanted to ask you all a question about the arts and culture piece, because I just need, I think everyone's talked about that. I know it's been made a priority, obviously, and as James mentioned, I mean, in a lot of cases, their money's been non-existent because they haven't been able to be open or they haven't been able to perform or what have you. It won't be quite the same as a business. I mean, you know, a small business, if you're a restaurant with some investments, you might be able to actually bring folks back. You might be able to open up safely. In the case of a lot of these performing arts venues, that's not even yet practical or possible. So, you know, we could treat a program with arts and culture similar to what really the early kind of payroll preservation or protection programs were at the federal level, or those where it was basically a grant, for lack of a better term, to keep them in business. I mean, it was basically, here's money to keep folks actually able to be in that line of work so that when it does open, they're ready to do. And obviously, we've talked a little bit about there may be some opportunity also to fund some kind of unique partnerships like performing arts with restaurants and those kinds of things. But I just wanted to check with you all, are you thinking that predominantly it is a case of where you show a loss of revenue as a performing arts venue or as a cultural organization or entity, and you are able to, in effect, tap into this grant to try to help you to sustain you until things can open back up? Is that what folks are thinking?
Yeah,
I think that's a good idea. Go ahead.
Rachel?
Well, no, Shalene, either one. I would say we're both, you know, also representing arts and cultural organizations. And I don't want to speak on behalf of the Science Museum, but I will tell you, for example, Mill Mountain Theater, they not only lost the revenue that would have come in from roughly March until now through all of the performances they put on, and of course the relationships that we all have with downtown businesses and restaurants. You know, it's so intertwined. However, the other thing that they've lost is 2-3 years of work, you know, and so this isn't something that is an acute transaction. As an arts and cultural organization, the position that we've been put in is that the revenue that we would have received through admissions and through programming as of around March 16th till the present would support what we are doing in the next 2 years. We work in those time, you know, those windows of time. So it's really detrimental. And it's even more clear with, of course, performing arts organizations. So I think it's imperative, and it's so interconnected, you know, and with small businesses and restaurants and gig workers.
Yeah, and I think a piece of this is, you know, when we started this early conversation, it was to try to identify, and I don't know how else to say this other than things that make our local economy unique. I mean, things that make us competitive. And one of those, you know, some of those things at the local level are these small businesses, restaurants that we have that are unique in our community, arts and culture. And in a lot of cases, this is really about keeping them alive while we actually try to reopen and combine with kind of the marketing of the tourism and the outdoors and that type of thing. Because if all we're left with when all this is done is Walmart and Costco, well, we don't have Costco, but Walmart and BJ's and, you know, McDonald's, then we've lost a bit of our competitive edge that we've been building a lot of our local economy on, and we lose some aspect of that resiliency. And so, and again, I just wanted to kind of verify that, you know, in those cases, you know, yes, that may be some, obviously small businesses, but even in cultural organizations, it may be some back office assistance, but in a lot of cases, it's really dollars just to keep them alive based off of what they've lost in the last couple of months. And again, hoping that in the meantime, there is some resolution that allows them to safely open and conduct their business or get back into the business of providing arts and culture and those kinds of things. Okay,
hey, Bob, this is Shalene. Can you hear me?
Yes.
Hey, I agree with everything that Rachel just said. And Joyce Wall made a good point too in the comment section. When I see all the bullet points laid out under economy, it's such an ecosystem. Like everything is connected to one another. Like, for example, it's so important to market the reopening and tourism because those funds come in, but you're promoting a product, and the product is everything unique that Roanoke offers. And the outdoors, like funds to maintain and enhance outdoor assets, that is a huge component. People are going to want to be outside. But also, if we don't keep the lifeline of arts and culture organizations going so that when it is safe to reopen, they have a foot forward, then I think we would be missing something here. So I think that the PPP, kind of what you had outlined is just keeping a lifeline going, is very important.
Okay, all right. So what I'm hearing kind of as a consensus around this particular category of economy is, obviously everything on this list is important. I mean, everything was a priority. That's why it made it onto this list, which is good, not a problem. And if we were to elevate anything a bit beyond that, and this is okay, and I'll explain why this is okay, then it'd be that small business piece. That small business piece is a bit higher than the others. And the reason that's okay is, remember, and this gets to Brenda's point, and it gets to our equity lens piece also, is in addition to the CARES funding, we also have a chunk of dollars that are set aside out of the CDBG side that are designed for small business assistance. And the CDBG side is going to have a lean toward those lower income businesses. I mean, those businesses that benefit folks that happen to be in our more struggling or vulnerable areas. So I think there's a way to do both of that, to kind of elevate the small businesses that cater to, I mean, a small business can cater to a higher end market, and that's fine. We also have a piece of dollars that can be elevating small businesses that perhaps have either employ more parts of our vulnerable population or even are located physically in those areas and stuff. So that it seems like we're saying pretty much everything is important in this priority. So yep, that's a good thing. Let's elevate small business a bit above those. Is that an accurate statement? All right, I'm seeing lots of nodding heads. So okay, we're
Yes.
good with that. See, I told you all make good politicians as we as we go through this. So with my apologies to the mayor and vice mayor, again, I'll keep doing that for you guys. So the other category is the safety net category. And in this one, we've talked about funds targeted to assist nonprofits. So think of that as much like we just talked about in the cultural, where that's really probably grants to nonprofits to say, you've lost revenue and income. Here's some money that actually kind of makes up for that lost revenue. A nonprofit system navigation and communication, something to help folks navigate that overall system is one of them. Addressing basic needs, and this gets into this childcare, access to healthy food, rent, utility, mortgage assistance, kind of as a package. And then interpretive services, and that was in the broadest sense of interpretive, meaning focusing on empowering vulnerable communities to educate and inform themselves about issues, needs, and responses. And actually, in a lot of ways, that one is not much different than what we talked about with kind of the advocacy wrapping around the students, kind of helping make sure that the students that are perhaps the most vulnerable have this system built around them to help them succeed. On this one, it's really the populations that we have in the community that are really struggling the most in the post-COVID or dealing with COVID. So I'll use, for example, you all know that the local Hispanic population is disproportionately being impacted by COVID much more significantly than anyone else. And in a lot of ways, it's because of the disconnect in the communication and the support around what the response is right now with COVID. So that would be an example where you would find a way in which you have programs that could ensure that culturally appropriate information is getting delivered and those folks are getting supported in proper ways as they try to deal with COVID. So that's what I would put into kind of that category. So out of that list, I'm gonna venture out on a limb based on your previous conversations. I would assume, although correct me if I'm wrong, that line about addressing those basic needs, those things about childcare, access to food, utility assistance, that's the one that kind of rises perhaps slightly above the others based on the conversations I've heard from you all. Is that, I'm seeing lots of nodding heads. Anyone disagree with that? And again, not that those others aren't going to get funded, just saying, hey, if we were to put an emphasis, the emphasis really is around those basic kind of needs. Okay, everybody's good with that. And Abby was asking about transportation and healthcare access as a part of basic needs. Yes, I would define that those basic needs as broadly as possible. And again, I'll talk in a little bit about how I think we can maybe operationalize some of these to bring them into kind of implementation. And then Joyce mentioned that dental was part of what was emphasized. And yes, I think the dental piece gets addressed with the addition of that item you all added relative to health clinics in the health kind of category. So that would be going to you know, the groups and saying there's a certain amount of funding to assist them in where they're seeing not unmet needs, but needs that are stressing or straining their systems, and dollars that can go toward that effort. Well, at this point, let me pause and sort of explain conceptually how this may work as we go forward in terms of implementation, not in terms of adoption. I'll come back to that in a minute, but in terms of implementation, you know, I think a couple of you, I know Jan had mentioned this and a couple of others at the beginning, and I completely agree that in order for us to deliver these dollars in the most effective way within the time frame that we have for most of these dollars, it is going to best be delivered by folks that are already in this business. So people that already are set up to do this. So I'll use the utility relief one as an example. It's the easy one. So we obviously have that identified as a priority. We'll ultimately work on figuring out what amount of money based on the percentages and what can get plugged over into that area. But whatever that dollar amount is, that is going to best be served by the city offering into the existing program that United Way and others are currently managing and saying, here are dollars to extend that program, that effort. That's going to be the fastest way to deliver that. Same with like mortgage and rent assistance. The state is already using TAP to actually deliver those services on behalf of the state. It's going to be easiest to plug into that and say, we want these dollars to go toward that particular effort. Back office help, for example, might be talking to the Small Business Development Center and saying, if we were to provide funds so that small businesses all across our community had access to attorneys, accountants, whoever it might be, on basically almost like an on-call basis, is that best done in Small Business Development Center quickly, or is there another entity? But so that's the way I'm thinking a piece of those dollars could get quickly put out into the community. There are other areas where I'm thinking it would be more valuable to use something like we currently do with the Arts Commission, the Cultural Endowment, with the Human Services Advisory Board, where we have a very quick window of proposals, basically a call for proposals. It might be a week. I mean, we might say, okay, we have provided funds to assist nonprofits in addressing you know, their needs associated with being able to actually provide additional services in a COVID world, whatever it is. And they would craft with certain guidelines a proposal that then somebody, maybe it would be the Health Services or the Human Services Advisory Board, would review those and ultimately make those awards using some of that infrastructure that we already have, trying to minimize the number of new things that we need actually to stand up in terms of organizations, because it's going to be so difficult in light of the time that we have associated with it. There are a few of these items that are on this list that I think probably exceed the timeline that we have with the CARES money, and probably don't easily have a group that could step in and say, that's the group. And in those cases, what we'll probably do is identify the funds that don't have that same timeline attached to it. And in those cases, we may have to stand up some new initiative or new effort, but we bought time because we're using that money that allows us to go forward. So that kind of, I'm beginning to think that that's kind of how I would advise the council once they've decided that, yes, these are the projects and the initiatives that we want to go toward, how we would actually deliver kind of these efforts with it. And, you know, and again, the challenge is going to be if we hand, I'll say, for example, if we put out a call for proposals, or if we just said we're going to make funding available to all the health clinics, and we did that through our social services department, for example, the health clinics then would have to deliver whatever it is they've said that we're going to deliver within the time frame that we have. So it's, you know, it gets a little bit complicated as we move through it, but I think it's just going to be a lot faster if we can get it into the hands of those providers directly rather than trying to create new bureaucracy to actually implement any aspect of this. So at that, I'm going to stop talking and offer up an opportunity for you to put any thoughts forward about any of that. Yes, Joe. Yes.
Yeah, I just wanted to say that whatever process is determined, we need to make it long enough to make sure that those communities and businesses that have been disproportionately impacted and affected by this, by COVID-19, have access. It goes back to communication. If we just do a shortened 1-week proposal process, I'm really concerned that the people who most need to access these funds are not even going to hear about it in a week unless we're very intentional about making sure they do. That to me is a major equity question and through the whole process. But and I know we've got a real condensed process here, but I think if we keep asking that and keeping that on the forefront, that's going to be really critical in making sure that folks who need these funds have access to the process and don't show up, a month later or 2 months later and say, I didn't even know about it.
Yeah, I agree. And I think, and James just made a similar comment on here. And I know Elda has previously, reminded everyone that when the payroll preservation programs came out and even the emergency loans, that a lot of the minority owned businesses, either because they didn't have an existing banking relationship or they just weren't plugged in, actually got excluded from that process just because by the time they actually got ready to do that, the funds were gone. So I agree completely. We'll have to figure out what the right amount of timing is to make sure that it leaves room to do whatever it is they say they're going to do, but not overly accelerate it to where it excludes folks. I will also add, I think it's also going to require us to have a pretty robust outreach and communication plan to accompany this so that it is very approachable by folks. And that means using channels that we don't normally use, that we've got to figure out how we plug into those channels and be able to do that. So I agree. Some of them will be easier than others. Like, for example, a program that is mortgage and rent support, just reaching out directly to TAP and doing that, the day after council approves it, it's pretty straightforward because it's like they're set up, you want to get that money to them so that they can start implementing it. But other ones where we're talking about like folks actually seeking small business assistance or a cultural organization, I think we want to make sure that we're as inclusive in that process as we possibly can. So I'm glad that you all raised that piece because we're going to need to do that.
Bob, this is Elda. I'm going to jump in since my name was mentioned. And I think I'm going to dovetail on what Vice Mayor Cobb said. I think it's not only a matter of the communication, the information being available, the access being there, but because a lot of these small businesses, nonprofits that we're talking about, this is basically a lifeline, right? I think, we're at such a critical point right now that these are lifelines to keep small businesses and organizations afloat until we get to that next step, until we get people back in the door. And so I think we need to be really conscious about streamlining the process as much as possible so that it's not only a matter of hearing of there are funds to apply for, but that the actual application be streamlined, straightforward, so that folks who are used to applying for things, who might have a staff that works through RFPs and that kind of thing, that's an easy process. But for folks who have not done something like that before, that it's really accessible. Yeah. So that we're not only communicating these opportunities are available, but we're making those opportunities and the access to them really easy step-by-step processes, because it's not a matter of additional funds for new projects. These are lifelines that we're making available.
Yeah, that's an excellent point. And I think, if I'll use the county as an example where the mayor had asked about kind of their small business program that they have out right now. And their application is pretty basic, pretty simple. And I'll give you a really good example. The CARES Act requires us to only basically businesses that have suffered an economic loss as a result of COVID is a prerequisite. So what the county did is the county has a checkbox, and the question is, did your business suffer economic loss due to COVID? Yes or no? And the box check is yes. There's no, give us give us some tax form, give us these receipts, it's just saying, yes, I suffered those economic losses. And I think it's things, obviously you have to guard against fraud and those kinds of things, but, I think it's keeping things as simple as they possibly can be, so even in the application, in addition to the awareness is a really good point. Even maybe figuring out ways as we go through this, there may be things that we need to do in terms of, some kind of workshop or open house where we're out in these areas with the businesses trying to make sure that, they can, you don't want somebody to get halfway through what we think is simple and then they give up. And if you're standing next to them and say, no, actually it's just as simple as just saying this, or we just need that one piece of information that, it may be that kind of assistance that we need to be able to find folks that can help us offer that as we go along. But yeah, all really good points. Because again, we want, we've said this from the beginning that a lot of this really is plugging the gap, throwing out a lifeline, but hopefully doing it with two things in mind. To the extent possible, how does it make them and the community more resilient? The other is, how do we use this moment in time and frankly, this unprecedented amount of money that we've been given to address inequities to the extent that we can. So I think those two things have to be critical in what drive us and they've already driven us to the list that you've come up. We need to make sure they continue to drive us through the process that gets the money out there as well. And to me, that is the purpose of doing this effort. If we weren't going to do that, we really could have a month ago just gone to council and said, here's 9 programs that we think you ought to fund, and we would post it up on our website and say you're good to go. I think the idea of this was really to try to make it more representative of the community and address those things that you all have. And we need to make sure we follow that through all the way to the end. Yeah, and there's some, Tony's mentioned in here, we've got, again, using established organizations. Abby's right. Abby mentioned, I think, that, we've got some things like central intake. We've got some structure put in place that, at least for those entities that are used to doing those things, can plug directly into it. So when we get into the nonprofit piece, again, that's why I use the Arts Commission as an example. We have among the arts groups, they're very comfortable and understand that process. We don't want to create a new process for that. I think it's trickier when we get into those areas like small businesses where there's not that natural kind of, especially for the small businesses that may be a little more vulnerable, maybe, single person or those kinds of things. There's not that natural kind of fit for those. And we just need to make sure we figure out how to do that well. I'm sorry, I'm just looking through some of the comments here, see if there's anything else I want to grab. I like Shalene's old school billboards work, and they do indeed. I mean, I think, whatever it takes to get the word out. I have to admit, out of everything that we've talked about, the one that probably feels to me like the heaviest lift that gives me and is also very important, actually is oriented around this advocacy with the youth and school, because it's something somewhat new, although I have a little bit of, it gives me a little bit of confidence in knowing that we've got groups, and y'all have mentioned several of them on here already, whether it's Humble Hustle or whether it's Boys and Girls Club. We've got a lot of those kinds of groups that are out there that always are advocating for youth, that maybe we can tap into that network and be able to help us kind of develop something. But it feels daunting just because that one I know is so important, and also because the school year is about to begin, not too far off. So trying to figure out how to make that work, but we'll figure out what we can do with that. And again, even though I said the good news for y'all is this is the last group, that again, I'll add a new bad news maybe is y'all are our resources too. So as we develop this stuff going forward, we're going to be calling on you for help to say, hey, how would we do this? What makes sense? I mean, you all are here because of particular perspectives and influence that you have in the community that will help us with that. As we go along as well. With that, let me now hopefully explain how we wrap all this together. So, we've got, I think we've got a list of priorities we all have pretty good consensus on, and we've pulled out a couple of things that we say we really would like to highlight in those areas. We've continued to kind of develop sort of percentage-wise how the dollars more or less would be kind of divvied up among those. As I said, it could be as simple as just that list with an explanation that's presented to council on Monday. Hopefully, if I can manage it, what it'll do, it'll be wrapped around with some more information that helps illustrate a bit further what we're trying to do. If that goes well, I'll get that out to you all prior to the council meeting, but it could literally be Sunday or Monday morning that I get it out to you. So it will be, it'll be kind of somewhat last minute to say, here's sort of the document, if you will. But again, understand that what's on the list that you all put together is what will go forward. It's all the other stuff that will still be getting created. Then what will happen is the council on Monday, on the 20th, will convene, and they have an item on their agenda for this. The council actually will be mostly convening in person on Monday. So I think right now 5 council members will attend in person and 2 will be calling in. We're really trying hard not to have very large crowds still in the council chambers. And while I would absolutely love, because you guys have been so committed, to have 36 folks standing in the council chambers, I don't know if that's the best thing to do at this point in time. So what I would suggest is if there are 1 or 2 of you, and of course, obviously the mayor and vice mayor have been a part of this all along and can certainly provide information, but I think there would be benefit perhaps in a couple of members of the task force that might be willing to come to the meeting and offer a perspective. I would open that option up for a couple of folks. If there are any of you that feel comfortable doing that, I'd like to keep it down to like maybe a couple, because again, I don't want to overwhelm. I don't want to shortchange you all the opportunity to be recognized for your hard work. At the same time, I don't want to put a bunch of people unnecessarily in risk by having everybody cram into a council chambers and stuff.
Is this the 2 o'clock? No, the 7th.
This one will be at the 2 o'clock meeting, I believe. Yeah, I think we just went through the agenda, so it should be at the 2 o'clock. I'm going to come back, put a note on that one. I'm going to come back to that one. So after the 20th, so let's say the council takes in, they say, y'all have done an outstandingly great job. We concur and exactly, move forward. Between now and Monday, I'm going to be pulling together some staff resources so that if that does occur, so that on the 20th, the council says, we agree, proceed, then the staff will have already identified kind of some of what we've talked about, which is, okay, if we had to actually stand up an application process for small businesses, how do we technically do that? What does that look like? If we need actually to get money into TAP's hands, who's going to take that lead? What are we going to do? So the idea is, as soon after the 20th as absolutely possible, we'll start actually beginning to actually deliver dollars where it makes sense and beginning the process where we need to solicit ideas or proposals or whatever that might be as well. So, I would say by the end of next week, all of that should be figured out. So everything should be up and running in some fashion as we go forward with it. Again, I will say that I think the school piece is in a bit of evolution, but I think where you all have landed with kind of this advocacy piece is going to be needed no matter what the school comes up with. So I think we can continue to advance down that path, even while their plans kind of continue to develop and kind of work their way through. So I feel like, we're not going to lose any ground associated with that. And we will certainly maintain our contact with the superintendent so that we know if that evolves or changes. And I've asked her to share with us, any particular needs that stand out that it looks like the school's not going to be able to meet that fall within these categories that we can kind of jump in and plug the hole with on it as well. So that's how right now I see this kind of thing coming to a sort of a close and getting presented. What questions, concerns, what might be on your mind about where we are and where we end up next Monday?
If some of the nonprofits are interested in applying, how exactly do they go about applying? Has that been set up or thought out, or would they just contact the city manager's office?
Yeah, that'll be part of what I'll be talking with the staff about, and it probably partly depends on which of these you fall into. So if for example, it is, let's say a grant program that we're going to make grants available to nonprofits, what we probably would do is we would have some application process, probably using the infrastructure we already have in place for the Human Services Advisory Board. And so that would just be issued and say that all existing nonprofits have access to this program subject to these criteria. Here's the application process that would go in. If it's a new initiative for something tied to nonprofits, that's a piece we have to talk about. What does that application look like? Who's that best through? I think most of these would be able to plug into something we already have, but a few of them we would have to create new. And we would, that's information we would get out there starting next week.
Okay, thank you.
Yeah, thank you. Other thoughts, questions? Everybody generally good with that approach? You all feel comfortable with the recommendations? You feel like, yep, this represents what we need to focus our energy on and where these dollars go. Everybody do y'all feel like you understand what's in these recommendations? I mean, everybody have a good
Yes.
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 All right, very good. So you all want to talk about a couple of people that would be willing to come to the council meeting and wear your masks and talk about how hard you worked?
Be ready
to try to be there.
I would be interested in doing it. That was Chris Bryant.
Okay, all right. Tommy, is that?
I will be there.
Brenda's going to be there. All right, so we got Brenda and Chris. Everybody good with that? And so the rest of you know it'll be like a normal council meeting. So it'll be broadcast on RVTV 3, and it will be broadcast live on Facebook. So obviously you all will be able to view it as well. And again, sorry that we're not going to be able to have everyone there. I think what we will do though is somehow we'll probably grab one of these screenshots or a couple of these screenshots so that we can at least show everyone who was involved in these processes and stuff. Because again, you all have done a phenomenal amount of work in a very short order. I think Jan said it up at one of the very first comments on the chat today. She said something to the effect of, wow, this is our last meeting and look at all the people that are still here. I mean, I have been very impressed with the effort that you all have put in to this. And I genuinely believe that you've made what we will be recommending to the council much richer because of it. And I think it will be truly responsive of what the community needs as we move forward. And, my objective is that we don't send a penny of this back to the federal government, that we've spent every penny of it for meeting the needs of our community. So that's my objective. And I think with your help, we will make that happen. Do our part to keep things moving forward. So,
hey Bob, will there be a final report sent out to the task force with the recommendations that were made, as well as the way that the council will actually apply everything that was discussed and what the final decisions are?
Yes, and I'll do that probably in a couple of ways. What I'll do is very quickly, I will push out the revised list of recommendations and kind of highlight it things. That'll be just that one pager. So that'll go out very quickly to you all. Then hopefully over the weekend, I'll get out to you more of a report. So it'll have that embedded in, 5-10 pages, whatever, that cover kind of some of the background and some of the process. That hopefully will get pushed out to you by the end of the weekend. And really that will be mostly for your information, but if anybody sees a glaring error in there, certainly let me know. So that'll be one piece. Then after the council acts, what I'll probably do is take that document, and if anything changes as a result of the council action, I'll refine that and get that back out to you all. And then there'll probably be, within a week or so of that, I would imagine some kind of, for lack of a better term, some kind of appendix that would actually detail not just the recommendations, but the process. This is how we'll use it and stuff. So
that's good. That's good. Okay. Thank you.
I don't want to make it overly bureaucratic for everyone, but I think documenting it will be helpful. And truthfully, we'll use that information as we're out there talking with folks about applying for dollars and that type of stuff.
Perfect. Thank you.
Yeah, thank you.
Bob, can you hear me?
Yes, yep.
I would like, if possible, and it's up to them, if either Christian or Brianna could come to the meeting on Monday. I think that always is something good when we get our youth that are involved. And I think that will be impressive to council if they have the time, if they can. I know everybody's schedules are tight now, but I think if either one of them could, or both, but if either one of them could come, I think I'd appreciate it, and I know council would really appreciate their work and effort in being a part of this task force.
Yeah, and I would open that up to you, Christian, and you, Brianna, and what your thoughts are.
Just send out the information and I'm there. Being confined to home, I'm able to get out and participate wherever you guys need me. So that's a good idea.
Brianna, any thoughts?
I would have to ask my parents about that one. I will get back to you.
I like that answer. That's a good answer.
And I would volunteer to pick them up if needed.
Okay, very good. Thank you,
Thank
Brenda.
you. Thank you.
And we will, you know, Brianna and Christian, as you're talking to your folks, you know, we will, and the council knows this, I mean, we are practicing as safe an environment as we can. So when folks come into our building, everyone's required to wear a face mask that comes into the building. You're not allowed in the building, obviously, if you have any symptoms, obviously, associated with COVID. Once you're in the council chambers, everyone is spaced at least 6 foot apart. And that therefore limits how many people are in the room at any one time. And so and council itself is sitting about 15 or 20 feet away from where folks are actually speaking. So if they ask, and you know, those are some of the safety steps that we've taken in place with it within the building and stuff. So, all right, well that sounds great. So that has us then having all things. Right now we got Brenda and Chris, and then if Christian's able to make it, and if Brianna's able to make it, those will be our 4 representatives of the task force, along with obviously the mayor and vice mayor serving as the chair and co-chair, being able to present all of the information and all the hard work that you all have done. As Jarrell has asked, I'll follow up fairly quickly with the 1-pager, and then sometime over the weekend, hopefully get out to you all a little bit more complete report. And then after council acts, we'll wrap that back up, follow that back up behind as well. All right, Mayor, I think that is all we had. So it is yours to call for adjournment unless anybody else has anything else they want to add. I greatly appreciate all the comments on the side and all of the help and all of the good compliments for the effort. So thank you, Mayor.
All right, well, thank everybody. Joe has sent out the statement, I think is well stated in terms of the commitment and dedication that you all have given to this. And it's about Roanoke, and as we recover and stand resilient to what COVID-19 has done and is doing in our community. So I'm proud of each and every one of you. I look forward to somehow serving you down the road as we go forward. But that's why Roanoke is the type of city that it is, an all-American city, because of you all, because of you. And we've got a very talented city. Thank you all for your input. Bob, thank you for your work and diligence in putting this together and leading us through it. So thank each and every one of you. Be safe. If there's a motion to adjourn, I'll entertain it right now.
Move to adjourn.
All right.
A second. Christian.
All right. Well, I know everybody's going to approve of that, though. All those in favor, say, let it be known by the saying of aye.
Aye.
Thank you all.
Great day, everybody.
Take care. Be safe. Thank you so much.
Thank you.